for morphine 50 milligrams, 50 mils. Okay. So, hi Miriam. I'm Leha. I'm the student nurse looking after you today. I can see that you've got fractured rib, which is extremely painful, and the doctor's prescribed you morphine 50 milligrams, 50 mils. But before that, can I please get your identity and confirm your full name and date of birth, please?
It's Maria Madi. My date of birth is January the 7th, 1969.
Yeah, I'm checking it against your armband as well, and the MRN 174963, 174963. That's correct. Yeah. So I'm just gonna look at the cannula site. Is there any? There's no sign of redness. Is there any pain around the cannula site?
No, I can feel it.
Okay. And lastly, have you got any known allergies?
No, I haven't.
Okay, no known allergies. Yeah. So I'll get everything ready, and then I'll be back to you shortly. Okay.
Okay, thank you.
Oh yeah, and quickly, can I ask you that I've seen that you've got fractured rib. Can you rate your pain out of 10, 1 being the least painful and 10 being the most painful?
It's about 8.
Oh, that's really painful. Okay, I'll just try to organize your medication as soon as possible. Okay.
Thank you.
Here's the buzzer if you want anything. I'll come back.
Thank you.
Okay. Now, will you be? I'm just gonna validate my medication order.
Yeah.
So I've got my right person here, Miriam Adib. I've checked her name and identity with her and against her armband, which is correct, and she hasn't got any known allergies. Yeah. So the doctor's prescribed here morphine 50 milligrams, 50 mils. The doctor signed and printed the name with the date. The drug to be given is PCA IV morphine with the concentration 50 milligrams morphine in normal saline 50 mils. The concentration to be given is 1 milligram per mil. And there are 3 number of syringes to be given. The PCA dose is 1 milligrams, and the lockout interval time is 5 minutes. And there's no basal infusion, and the hourly dose limit is 12 milligrams, and the doctor signed. And the doctor's also prescribed antiemetic if the patient feels nauseous, and naloxone if we overdose the medication.
Okay, I agree.
Yep. So now it's gonna use the MIMS. Morphine's used as opioid analgesic for moderate to severe pain. The contraindication can be bronchial asthma, obstructive airway disease, respiratory depression. The precaution can be high dose. The adverse effects can be respiratory depression, dizziness, sweating. And the PCA demand is for adults 0.5 to 1.5 milligrams, and the lockout interval time is 6 to 10 minutes. Okay. Now I'm gonna gather all my equipments. Which is here, and we should have done the baseline obs as well for our patient. The baseline obs can be recorded here, but we're not doing for this assessment. Yep. Let's go and get the drugs from the cupboard. Morphine 10 milligrams, page 28. 29, yep. We're ready. Morphine 10 milligrams per 2 meals. Okay, so now before that I can quickly do the calculation, the drug calculation. So the doctors prescribed 50 milligrams per 50 mils of of morphine. So we're just gonna use 10 mils of normal saline, which makes up to 40 mils, and use 5 morphine ampules, which is 10 milligrams each, which is 50 mils, with 2 mils each, 10 mils, which makes up to 50 milligrams per 50 mils. Okay, I'm just gonna write that down. Also, but before that, we'll just do the first drug check, or I'm just gonna do that first and then do the drug check after that. Times 1430 Miriam Adib, 50 milligrams. So we've got 1, 2, 3, 4, 5 left, and there's no more left. So just gonna do the balance 0. We're not discarding any. The prescriber is Linian Hunt, and that's me administering the medication. And so 1, 2, 3, 4, 5. Which the previous one was 5, and the balance now is 0. We haven't got any morphine left. Do you want to co-sign that with me, please? And your signature. Thank you. Just going to pop that back in the drug cupboard. Okay, we just do the first drug check. So I've got my patient here, Miriam Adib. I've checked her ID against with her armband. You be my second hour into this first drug check? Yeah. So got the patient here, checked her ID with her and against her armband, which is correct. She hasn't got any known allergies. The doctor prescribed her IV morphine, 50 milligrams, 50 ml, signed and printed the name, and that it's not been given yet. The time to be given is now. Route is IV, and medication dose time. So I've got 4 of normal saline here expiring February of 18th, and morphine, 5 of the morphine sulfate injection, 10 milligrams expiring 10th of the 20. Sorry. Yep. Expiring.
Yeah. Oh,
20. Agree?
20. Yeah. Oh, okay.
So that makes up to 50 milligrams per 50 mils. Okay, so we'll go back near my patient and I'm going to drop the medication now. Before I draw the medication, I'm just going to clean my hands. I'm going to drop the normal saline first so that we don't discard the morphine. I'm just gonna drop my morphine now. Okay, so I've got 50 meals. Can you be my second RN? Oh, it's hard. I haven't got any. Okay. What I can do is just connect that up on the top bit. We can do the second drug check and then I'll just do this. And can you give me a second RN to do the second drug check with me?
Sure.
So I've got my patient here, Miriam Adib, and I've checked her ID against her and her armbands. She hasn't got any known allergies. The doctors prescribed her morphine 50 milligrams, 50 mils. I got 4 of these normal saline solicins, which make 40 mils, expiring February 18th, and 5 of these morphine sulfate solicin, 10 milligrams per 2 mils, expiring 10th of 20.
Yep, I agree.
That's morphine, and which has to be given via PCA IV, and the doctor signed and printed, which hasn't been given yet. Yeah. So I'm just gonna prime my line now. I'm just going to get the sub in here because the CPU staff said you have to return that back to her. So I'm not discarding that back in the subs container. Unclamped. Left unclamped. Okay. Normally we use normal saline in here with the morphine, but we're not doing this in this assessment. Just gonna prime my line. Mine's primed
And there's no other.
and there's no air bubbles. You agree with that? Okay, so we just do the third drop check. Can you be my second RN? So I've got this patient. I'll just wash my hands quickly. So I've got this patient here, Miriam Adib. I've checked her identity with her and against her armband. She hasn't got any known allergies. The doctor prescribed her morphine 50 milligrams, 50 mils. We've got normal saline 40 mils, expiring Feb 18th. All of that. That makes up to 40 mils and 10 milligrams each morphine sulfate with 10 mils each, which makes up to 50 milligrams, 50 mils, and expiring 10th of to 20, which hasn't been given yet. And the time to be given is now, which is to be given IV morphine, and which is morphine. Yep. And the doctor signed and printed the name, and I've got my morphine here. So I'll just fill my additive level. Patient is Miriam Adib, ID 174963, date of birth is 7th of the 1st 69, medications morphine 50 mg 50 mils, which makes up to 1 milligrams per mil. Diluent is normal saline. Dates 24th of the 3rd 17 times 1445, prepared by me, and just need the second RN to sign. Are you happy to sign? Checked by. Okay. Yep. Alright, Miriam, I'm back with the medication, but before I give you the medication, I just need to confirm your identity with you and against your armband. Is that alright?
Yes.
Can you tell me your full name and date of birth, please?
Maria Madi,
Yep,
January
Madi,
the
7th
7th,
of the 69, yep. And MRN 174963. Have you got any known allergies, Miriam?
No.
Okay, so I'm just going to set up the PCA and then I'll just connect it to your IV cannula, okay?
Thank you.
Just give me a second. Okay, I'll set up the PCA first. Okay, so I'm going to start the PCA now. Clear previous patient, yes. Confirm new patient, yes. So I'm going to modify the protocol now. So drug name's morphine, that's correct. Drug concentrations 1 milligram per ml. PCA dose 1 milligram. Lockout period 5 minutes. Occlusion level A. Continuous 0. Loading dose is 0. And maximum limit. So we're going to modify the maximum limit. Alter. Yep. And so we're going to modify that to 12. So just modifying that to 12 milligrams. Okay, so I'm gonna confirm that. So that's correct. Limit durations 1 hour and PCA delivery is start. That's correct. So just pressing OK. So the PCA dose 1 milligram. Lockout intervals 5 minutes. No continuous infusion. No loading dose. And maximum limit 12 milligram in 1 hour. And the drug is morphine 1 milligram. Okay, I'm just gonna get the gloves. Before the gloves, I'm just going to clean my hands first. Okay, Miriam, I'm just going to wipe your cannula side. Just going to connect this. I'm just going to confirm the protocol. Okay. Okay, so I'm just confirming the protocol. Everything's correct. Morphines 1 milligram per ml. PCA dose 1 milligram. Lockout interval 5 minutes. There's no continuous infusion, no loading dose. Dose limit is 12 milligrams in 1 hour, and that's stat. So that's confirming. Just okay.
Oh, did you? Yeah. I didn't know that. Yeah.
So yeah, that's correct. Okay. Start to begin the PCA. Okay, here Miriam, I'm just gonna let you know how to use this PCA. So whenever the lights up green, you can use the PCA. And then there's only certain time you can use the PCA whenever the light's green. Okay, so I'm just gonna. Can you press that for me once? Okay. If you hear the beeping sound, the medication's gone through you. Okay. And here's the buzzer. I'll come back within 15 minutes. To check you. If there's any adverse reactions, such as if you feel constipated or if you feel any nauseous or vomiting, you can just press the buzzer and let me know. All right? Okay. Yeah. Okay. All right. Can we sign up? Date up is 24th of the 3rd. 17, time up 14, 55, that's mine, and you want to sign yours? Yeah.
Just tie him up.